All right, everyone. Today we're going to be talking about hospitals. Last time we were together, we talked a lot about the outpatient side of the healthcare system. So today we're going to focus in on the inpatient side of our healthcare system, and specifically focusing around hospitals, where on outpatient we focused on clinics, centers, and agencies. So now we're going to look more on the hospital spectrum. So the first thing I want to go over is really what the difference is between, what do these terms mean? Hospital, inpatient, outpatient, clinic. How are they similar? How are they different? So with an inpatient, we have an overnight stay where we have a patient who's been admitted under a doctor's order into a facility that's going to cause them to stay overnight or multiple overnight stays. With the outpatient, the patient is not being kept overnight in a healthcare institution. They're really released the same day, so they can ambulate, they can walk out that same day out of the healthcare facility. So we have a couple of characteristics that work to define the hospital structure as we know it today. Hospitals generally have some type of organized physician staff along with a governing body in the term of board of directors or board of trustees. But they are responsible to certain types of stakeholders. Now, don't confuse this with shareholders. Shareholders come into play when we talk about for-profit entities, but as of right now, let's stick with stakeholders and kind of define what this means. So again, hospital generally responsible to stakeholders, and these can be populations like the community at large, our patients, our employees, our team members that work for our organization. We can have stakeholders like the government and different governmental agencies like CMS and state-ran agencies. When we look at third-party insurers, those can be a different type of stakeholder, as well as managed care organizations. And different types of accrediting organizations can all serve as stakeholders for a hospital system. So historically, what we would see or think of when we thought of the healthcare system is a hospital. We kind of saw this as the center of where we would go to get care. So it still kind of sits at the center of the healthcare system. But we're starting to see a shift, like we talked about last time, from inpatient to outpatient services. And two reasons that we talked about last time of why this shift is occurring is simply for cost containment, to bring down costs because of our decreasing levels of reimbursement, and then consumer preferences. So, people don't generally want to stay in the hospital. They want to be home where they can relax and they can recover and get better. So we're starting to see a lot of services that even within the hospital system itself that can be offered on the outpatient spectrum. And these are going to be things like your physical therapy, your occupational therapy, sleep lab, your laboratories, even departments like your emergency department services. So looking a little into the history of hospitals. So prior to the 20th century, if you'll recall back to when we were talking about the history of the health system and history of public health, we talked about that hospitals weren't always the place that we wanted to go for care. And if recall back to when we talked about almshouses and pest houses, almshouses being those more poorer houses that work to serve the medically indigent, the very poor and needy. And we didn't typically see the wealthier population visit hospitals just because the conditions were not very good. It wasn't really where you went to get better. You received a lot of in-home care. And we saw a lot of unskilled staff simply because medicine was looked at more like a trade than a profession at this time. But between 1872 and 1829, we saw a significant growth in the hospital structure, mainly due to technology advancements that helped us with recovery times, helped us offer better care. And we really started to see medicine and the hospital become linked together. So we still consider that the centerpiece of our healthcare delivery system today. And we also saw the awareness and advancement of the professionalism of nursing. It started, again, one of those professions that moved away from just being a trade to more formalized education, teaching evidence-based care to our nurses to provide care to patients. So looking 20th century and beyond, we started to see standardized medical education. So think back to the Flexner Report and how the AMA influenced that Flexner Report. And then in 1946, we saw the passage of the Hill-Burton Act under the Truman administration. And what this helped to do was really increase the expansion of the infrastructure of the hospital system. Because the thought behind this Hill-Burton Act was we're going to open up access to the population at large by building more facilities and more infrastructure so that they have facilities where they can access care. So through this act, we saw a huge expansion in the infrastructure of the hospital system. And then in 1965, we saw the creation of the Centers for Medicare and Medicaid Services. So we saw a lot of 65 plus retirees starting to enroll in Medicare, which helped to kind of increase the demand that's being put on hospital services, which further increased and necessitated the need for hospital expansion. About 1980s though, we started to see a lot of hospitals start to close because we had a shift in our payment system to a prospective payment system. So we were getting more of a fixed rate of payment per admission into our facility, and this really damaged hospitals in a way because now we had to start cutting our costs down where we were getting fee for service, and a patient would come in, we would give them a service, we would charge the fee, and we would get reimbursed. Now we're getting a capped amount every month, and if we go over, then we lose that money. So we needed to start figuring out ways to cut costs and be innovative with our care that we were delivering so that we can bring down recovery times to discharge our patients quicker. So it really did work to reduce, or hold back the growth in healthcare expenditures during this time. So when we look at how hospitals are structured, we have a couple different buckets, if you will, that we can place hospitals in, or different ways that we can look at them. One is through classifications. So these would be things like, is the hospital a level 1 trauma center, a level 2 trauma center, like Johnson City Medical Center or Bristol Regional Hospital, or Bristol Regional Medical Center, which Johnson City's are level 1, Bristol Regional's are level 2. We can look at them by specialty. So several years ago, Johnson City had something called the Johnson City Specialty Hospital, which primarily dealt with labor and delivery patients. It's since closed in and moved to Franklin Woods, but it was our specialty hospital here in this area. We can also look by ownership type. So we have for-profit, we have non-for-profit, we have public, which we'll define those later on through the lecture. Governance base, we can operate it more corporate. We can have a philanthropic governance structure, a faith-based governance structure. So there's different ways that we can categorize hospitals in terms of governance. And then we can also look at licensure and certification. So we're going to look at each one of these just a little bit more in detail. Ownership. When we talk about that classification descriptor, we can look at ownership in terms of public or private, so non-for-profit and for-profit organizations. We can look by duration of care. Is it long-term or short-term? Does the hospital have teaching status? So is it a teaching hospital? What level of care is it? So is it our level 1, level 2? Is it a government entity or government-owned hospital like a VA medical center? And we can also look at it by bed size. So we can go with a hospital like Johnson City Medical Center that's 500 beds, licensed, all the way to the smallest licensed hospital in the state of Tennessee, which would be Johnson County, and they have 1 licensed bed. So there's a lot of different ways that we can look at how hospitals are classified. And then we can also look based on payer status as well as Medicare designations. But we'll focus in on a couple aspects within the ownership bucket. So the first one we'll look at is publicly owned hospitals, and these are going to be ones that are owned typically by the state or local government or federal government. And these account for around 22% of the hospitals nationwide. Now it's important to note that within that 22%, 70% of those hospitals are Veterans Administration hospitals serving our military members. So 70% of those are what account for, or VA hospitals account for 70% of that 22%. So the next two that we can look at are non-for-profit and for-profit, kind of privately owned hospital systems. And the two that I'm going to point out here are Mountain States and HCA Holdings. So Mountain States being our non-for-profit healthcare organization, and then our proprietary HCA Holdings. Now these two combined count for about 87% of hospitals across the country, but I want to bring up the websites for each one so that we can kind of look at them and you can kind of start noticing the differences between the two. So the first one, Mountain States, very clean cut, very welcoming, talks a lot about their board of directors, their leadership, their mission, vision, values, kind of their history, highlights their community benefits and how they contribute to their communities. And then let's jump over to HCA Holdings. So HCA Holdings, again, are private, for-profit healthcare organization. And one thing I want to point out here, this one, if you can kind of start to notice, it's set up more like a corporation. So the home page, we can scroll over and it leads us right into investor relations. We can talk about pricing on the home page, and it covers stock information, SEC filings, things like that. So set up a little different in terms of how they're governed and how they're ran. But again, account for about 87% of hospitals across the country. So to kind of put this graphically for you, this came from the Kaiser Family Foundation, but this is the distribution of hospitals by ownership type. So we see 20%, like we said, of the almost 5,000 hospitals across the country, state and local government owned. And then we have the remainder, it's split more along the lines of non-for-profit. So you can see 58% for non-for-profit, and then we have 21% on the for-profit side. So heavily on the non-for-profit side, about split between for-profit and state and local governments. But let's look at the distribution across the country of each type of these different ownership types. So we see a lot of public hospital systems. Mainly, we see a lot down here in the South through Mississippi, Alabama, Georgia. We see a couple kind of strung through here through the Midwest, Iowa, Nebraska, Kansas, Oklahoma. And then, we have Louisiana down here, Hawaii, and then a couple others that are a little heavy populated, Minnesota, Texas, Indiana, and you'll see some up here in the Northeast region. Now we look at non-for-profit. Look how these are, or start to notice how these are distributed. We see heavily non-for-profit populated up here in the Northwest, in Nebraska, North Dakota, South Dakota, Wisconsin, and then we see Maine, New York, Vermont, all of our northeastern states heavily populated with more of our non-for-profit healthcare facilities. But then look at the sharp contrast to our for-profit health facilities. So we see almost, you can see a defined line here where we see not a lot of for-profit up in the Northwest or even up in the Northeast region, but we primarily see it in our bigger states, California, Texas, and then look at Tennessee and Florida. And now the reason Tennessee and Florida are heavily populated by for-profit facilities and why they kind of show up on this map is we have two main for-profit facilities in the country are based out of Tennessee and Florida. Community Healthcare Systems is based out of Nashville, Tennessee. It's one of the largest for-profit healthcare systems in the country, and they own several hospitals across a lot of these south and southeastern, and a little over into the southwestern state. They own a couple in Arkansas. And then you have HCA Holdings that's based out of Florida. They're a very large for-profit health system as well, and they own a lot of hospitals up here along the Atlantic coast, and then over into Mississippi and Alabama. But let's look at the trends over time across each one of these ownership types. So we have non-for-profit, starts out really strong in 1999, and then we start to see it on the decline around 2004, little uptick again in 2007, and we start to see it level out around 2008. But look down here at the for-profit, represented right here by the little triangles. We start to see, not a lot of for-profit hospitals owned around the 90s. And then all of a sudden we started to see this uptick in for-profit facilities because it's becoming more lucrative. It's a business that people want to be in because they can make some good money. So we start to see an uptick in for-profit facilities, and it continues to be on the rise. Oops, go back real quick. And then our more government type owned hospitals starts out right around 25% in 99, and then has slowly been on the decline ever since, down into 2015, so we're sitting at right about 20%. So again, you're going to see more of our public hospitals, and think where we saw them on the distribution map. You're going to see more of them in poorer areas, and they're simply set up there to take care of our more vulnerable populations that we're going to see there. So we're going to see a lot of patients that are on government-type sponsored programs like Medicare and Medicaid. But then our non-for-profit hospitals, these are hospitals that have a 501c3 designation, so they're going to be exempt from paying taxes out. And any tax contributions or charitable contributions that are made to these organizations can be considered tax write-offs at the end of the year. So a lot of people donate to these simply for the tax benefit. But when we contrast that to for-profit hospitals, we'll go over the difference between the two. So we have a lot of non-for-profits that are starting to convert over into for-profit facilities just because it is becoming a more lucrative benefit. And we're going to see a lot more of these entrepreneurial physicians starting to get into the for-profit business. So they'll begin referring their patients to their own clinics. But we have something called the Safe Harbor regulations, and I think the book does a good job of going over this. But we have the Safe Harbor regulations that really work to define what it means to have a payment and how that relates to business practices. So we don't have anything kind of unethical going on in the background, but it works to define what a payment means in terms of business practices and what we are going to consider kickbacks and what we're not, or bribes or what we're not. And it's really to keep unlawful payments or unlawful charges being sent to Medicare and Medicaid programs. So looking at the differences between for-profits and non-for-profits, one of the main differences is the non-for-profit is not going to have a distribution of dividends because they don't have shareholders. For-profits have people who buy stock. Think back to our HCA website. We went over investors, and they have stockholder reports and SEC filings. So for non-for-profits, they are not beholden to shareholders. They don't sell stock, so they're not going to have dividends that they have to pay out towards the end of the year. Instead of profits, they make something called revenues over expenses, and anything that's earned in excess of the expenses is invested back into the community, invested back into the business. So the two different types of systems, the for-profit and the non-for-profit, have different reasons why they operate the way they do, and one of the main reasons is that for-profits, they're in the business to make money because they have stockholders that they have to pay out to. Non-for-profits don't pay out to stockholders, so they are beholden to a couple different stakeholders than what we would see on the for-profit side. So we start to look at the governance of the hospital system. Now this is just a general outline of the governance structure. It's important to understand more of this organizational structure that we're going to see in the hospital. And it's no different than any other business you would go to. Let's take here at ETSU, for example. We have a chain of command that we have to follow. So if there's an issue I wouldn't necessarily go to the dean or to the president of the university, but there is a chain of command that I have to follow. Same with students. There's a chain of command to follow, and it's similar here in the hospital. So the governance structure is really going to help us understand and facilitate our own understanding of that chain of command. But it's also going to show which individual or supervisor or manager or department is going to be accountable for which area of the hospital. So how we've kind of divided out these responsibilities. Now when we start to look at the governance structure, it's really going to be dependent on the size of the healthcare facility. Like I said, this is just a general view of what the governance structure may look like. But with larger organizations, they're going to have more complicated structures. So let's compare Johnson City Medical Center to our smallest hospital in Tennessee, Johnson County Community. A very small, a significantly smaller institution. It's going to have a simpler organizational structure compared to something like the Med Center, who's going to be very complex and complicated in terms of their organizational structure. So we start here at the top with the board. This is our board of directors or board of trustees. And the administration, which we're going to call our C-suites because we have the CEO, which is our chief executive officer, CNO, our chief nursing officer, CMO, our chief medical officer, CFO, our chief financial officer, are all going to come out of this administrative department. Now those particular chief executive officer or chief nursing, medical, information, operational officers are going to report up to the CEO, and then the CEO will in turn report to the board. But departments under your administration are generally bucketed out into 4 different types. So we're going to have informational, therapeutic, diagnostic, and support. So when we look at informational, these are going to be departments like your billing and education, admissions, our IT departments, our human resources, any more type of your administrative type departments. Therapeutic is going to be more of our clinical departments. We're going to see here nursing, pharmacy, respiratory therapy, physical therapy, departments like that. Diagnostics are going to include things like your imaging, like radiology. We're also going to see emergency medicine services here, laboratories, anything that has diagnostic capabilities. And then our support services are going to be departments and entities like our housekeeping, maintenance, central supply, purchasing, departments that generally support the operations of the hospital.